Everybody.
Good.
Good to see you.
Good to see you as well.
Hey.
And then we will,
I turned you on.
oh, sorry. Thank you. But first we'll have introductions. My name's Arthur Griffin and I chair the Health and Human Services Committee. I'll go to my right.
Good afternoon, I'm Laura Meyer and I represent District 5.
I'm Mecklenburg County Commissioner Elaine Powell. I represent District 1.
Dr. Lee.
Oh, I'm sorry. My name is Wilma D. Leak and I represent the most powerful district in the county. That's just true. Leave my speaker alone. You told me to turn it on.
All right, we have a colleague with us as a guest today. Please introduce yourself, please.
Thank you. County Commissioner Susan Rodriguez McDowell, elected by the people of District 6.
Thank you very much. We have staff available. I will first start off with our Deputy County Manager.
Good afternoon, Anthony Trotman, Deputy County Manager.
Good afternoon, everyone. Robert Nesbitt, Chief of Staff for the Consolidated Human Services Agency.
Good afternoon, Taya Cruz, Assistant to Deputy Manager Trotman.
Yolanda Griffin, Director for Department of Community Resources.
Good afternoon, Renard Washington, Public Health Director.
Good afternoon, Stacy Lowry, Director of Community Support Services.
Good afternoon, Kim Henderson, Director of the Department of Child, Family, and Adult Services.
We have other staff, I assume, on this back row over here. If you please introduce yourself, please.
Good afternoon, Eric Ortega with the Department of Community Resources, Unified Workforce Development.
Shannon Maples, Department of Community Resources. Abby Wyatt, Livable Neck Coordinator. Ron Knight, Economic Development.
Righty. On this backside over here, please.
Clint James, Senior Management Analyst with Economic Services Division.
Mariah Long, Social Services Manager with Economic Services Division. Sandra Durham, Interim Deputy Division Director with the Economic Services Division.
Adonica Hampton, Economic Services Division Director.
Well, welcome and thanks to all for being present. Next on our agenda will be the adoption of our minutes from our last meeting. They were sent out to you earlier in the week. I hope you've had an opportunity to review the minutes. And if so,
move, Mr. Chairman.
is there a second with respect to the minutes? Properly moved and second. Is there any discussion or corrections? Hearing none, all those in favor say aye.
Aye.
Aye. All those opposed, same sign. The topic today is of interest to a number of folk, and it's about food and nutrition. And what I would ask my colleagues, if at all possible, if as they were making their presentations with the PowerPoint, if you can jot down the slide that they're on that you have a question about, and then we come back and then we'll have a couple of rounds of 3 minutes to ask questions. Is that okay with my colleagues?
Yes.
Okay, all right. All right, thank you. Before I call Mr. Trotman to introduce this, I just want to say for 20 years, I worked at Legal Aid Society here in Mecklenburg County from 1975 to 1995. And among my tasks was representing people in terms of public benefits, whether it's a Medicaid denial, food stamp denial, AFDC at that time that changed into TANF, et cetera, as well as doing disability work. So I'm familiar with this topic. It's an important topic. And that's why I'm so laser focused on upward mobility, because these systems are not designed to move people. When we sued, and I didn't sue, I'm not a lawyer, Ted Follett and Rich Hart sued. Ted Follett sued HUD in terms of scatter site housing because they were putting all public housing in one part of the county. The federal courts directed the city of Charlotte to put scattered sites to disperse some of the. When we did the research looking at the law, the 1937 National Housing Act law, the law started off by saying, in order to support the building and mortgage and finance industry, and then on down a paragraph or two, it talked about safe, sanitary, and decent housing. Same thing when we sued the state of North Carolina, sued the federal government about food stamps. The federal law starts off talking about to support the agricultural industry, farm subsidies, and down in there talked about nutritious meals and foods for residents. So just keep in mind sometimes that these programs are designed with certain expectations without the structure, any meaningful structure to help people break the cycle of poverty. So with that said, Mr. Trotman, I'm gonna turn it over to you to introduce the topic of the day. And I certainly want to say to Adonica, my deepest admiration and respect for you because she was out there hammering Laura at the county's house number 4 up on there. And I wasn't able to get up there. So I'm really thankful, and county thanks you and your team for the work that you were doing out there in building a home for the residents of Mecklenburg County. So Mr. Trotman, sure is yours.
Well, thank you, Commissioner, for that background and your 20-year commitment of this program and many of the other programs. Based off of the requests of several commissioners, we wanted to give you some background information on the food nutrition program, ultimately managed by the Department of Agriculture on down to the state, down to us. Talk about some of the current issues that occurred over the last 6 months and our plan to move forward to support the residents of Mecklenburg County. So I'll turn the presentation over to Adonica to begin, and she'll be accompanied by 2 of our staff members, Sandra Durham and Mariah. I always mess it up, Mariah Long. So Adonica, the floor is yours.
Thank you.
Good afternoon. Can you speak just a little bit louder, please, ma'am?
Yes, ma'am.
And thank you.
The mic was not on. Good afternoon, Chair Griffin, Health and Human Services Committee, Board of County Commissioners, colleagues, members of the public. My name is Adonica Hampton. I serve as the Economic Services Division Director. Thank you for this opportunity to provide an overview of our Food Nutrition Services Program, known federally as SNAP, regarding our service delivery. Today, I'm joined by 2 members of our leadership team that will join me today in the presentation. Sandra Durham, Interim Deputy Division Director, and Mariah Long, Food Nutrition Services Program Manager. We appreciate and thank our County Manager, Dina Diorio, Deputy County Manager, Anthony Trotman, and our Department Director, Yolanda Griffin, who is here. We thank them for our support and their leadership. During our presentation, we will provide you with divisional overview of the Food Nutrition Services Program, work strategies, service delivery updates, as well as staffing updates. But first, some information about our division and the services that we provide, that our staff provide. Although today is focused on food nutrition services, it's important to note that this is only one of many programs and services that our division provides. Other programs include Medicaid for families, children, adults, Work First Family Assistance, whose federal name is TANF, which stands for Temporary Assistance for Needy Families, which is limited cash assistance to families with children. Please know that the federal government may describe and call a program by one name, TANF, as an example, but North Carolina and states may call their local program by a different name. So in North Carolina, TANF is called Work First. Work First Employment Services. Our economic services social workers assist Work First customers in job search, training, and supportive services to enable them to secure employment and move towards self-sufficiency. Our Rise to Work program is our food and nutrition services employment and training program for food nutrition services recipients to increase their skills, attain employment and careers. This program is also administered by our economic services social work team. Then we have other programs such as energy programs. Low Income Energy Assistance Program, otherwise known as LEAP, is a seasonal program for heating that begins every December and runs through March. We also have a crisis intervention program, also known as SIP, that is a year-round program for both heating and cooling for individuals and families that are in crisis. So this is an overview of our core programs. I'll now provide a little bit information about our divisional structure as well as staffing. I'm going to highlight our staffing here, and later in the presentation, I'm going to provide more details about our food and nutrition services staffing in particular. So our economic services division transitioned to Department of Community Resources in February of this year, and we're so happy about that. I'm grateful to be one of the newest members of the team. I started my role at the end of May, and I'm grateful to be back in Mecklenburg County, where I started my social services career in 1989 as what was called then a food stamp worker, and now is food nutrition services, working in the same building that I worked in on Billingsley Road in 1989. Since this is my first time before you, my background just a little bit more. I have been a social services director in 2 North Carolina counties, small counties, and I've served as a worker in 2 large counties, of which Mecklenburg is one. I've also served at the state level in various state positions. Key among them is the Assistant Section Chief of Economic Services for the state of North Carolina, which are these programs that we're talking about today. I'll give you a snapshot. I've grouped at the bottom of this slide our staff into 4 groups: executive leaders and managers, our social work teams, our eligibility teams, as well as our administration teams. We have a 761 position workforce of very dedicated, capable employees. And our division, 659 are working in our eligibility programs. Again, I'm going to provide more details specific to food nutrition services staffing a little later. Now I'd like to talk to you a little bit about the workload of our agency and our teams. This graph depicts workload across all programs. So across all eligibility programs, our workload has and continues to increase. And I want to say Mecklenburg County is not alone. Again, I come here from being a local social services director, and even in small counties, we saw increases and are still experiencing increases in workload. This graph shows across all programs from pre-pandemic fiscal year 2019 until now, and projections with Medicaid expansion. This graph also tells you that over 376 individuals are receiving benefits across all programs in fiscal year 2023. When I speak about workload, I want to define that. Workload to our staff is when customers or residents come in or apply for benefits, they may be applying for services in multiple programs. Each of those programs have different qualifying eligibility criteria, different rules, different regulations, different timeframes. So if an individual is applying for food nutrition, Medicaid, and SIP, that's a workload of 3 different programs. Also, our customers apply initially. They report changes, must report changes throughout their time receiving the benefits and the services. And our staff must determine ongoing eligibility and recertify households periodically. So our employees process applications, process changes, process recertification, and that workload is depicted in this graph across all programs. And it shows that it's double. Now let's talk a little bit about the economic benefit, the amount of the benefit that is being delivered to our residents. Across all programs, Medicaid, food nutrition services, energy programs, Work First, $1.5 billion in benefits delivered in fiscal year 2023 across those core programs. Specifically in the food nutrition services program, $434 million in food nutrition services have been provided to our residents here in Mecklenburg County. According to a May 2013 report on the Center of Budget and Policy Priorities, over 80% of SNAP, that's the federal name, households have a gross income below the poverty line. That's important to know. Also, most SNAP households are working households. According to a March 15th, 2018 Center on Policy and Budget Priorities report that's entitled Working Age SNAP Participants, but Often Unstable Jobs. Millions of workers are in jobs that provide low pay, have shifts that change, and lack key benefits like sick leave, which contributes to the volatility and job turnover. Those are many of who are receiving these benefits. The report also stated nearly 3/4 of adults who participate in SNAP in a typical month work either that month or within a year of that month of participation. The report also says that SNAP participants among non-disabled adults is often short-term. However, those who receive SNAP for longer periods still work most of the time. Lastly, SNAP participants who are consistently out of work often face barriers to work and have caretaking responsibilities. Just a little information about the customers we serve. With that said, I'm going to give some high-level information about the program in general. Nationally, this program is known as SNAP, which stands for Supplemental Nutritional Assistance Program, but in North Carolina it's called Food and Nutrition Services. This federal program dates back to the Great Depression. It began in 1964, took several years to ramp up. It's the nation's largest food assistance program, according to the USDA, and it is the most effective anti-hunger program in the United States, according to feedamerica.org. This program is a supplemental program. It's not designed to meet the full need of a household. It's designed to help families who are low income with their monthly food expenses. This program also shows up when there's a disaster. Yes, our staff, our food nutrition services staff, and maybe other staff in the division will administer a disaster food nutrition program when a disaster is declared. Oversight of the program. Federal government oversees this program. This is a federal entitlement program administered by the U.S. Department of Agriculture, USDA. And the USDA is responsible for providing policy and guidance to states. The Food Nutrition or SNAP program is a federal entitlement program. Entitlement means that benefit, if a family receives a $200 benefit for food nutrition services, that benefit doesn't run out. And as long as a family or individual is eligible, that benefit will be there, okay? The state provides guidance and supervisions to local county departments of social services. And our county staff determine eligibility for applicants, periodically review eligibility requirements. They authorize the benefit for those households who are certified and eligible. And they provide an opportunity for fair hearings according to policy when there's disputes. I want to mention lastly that 50% of the salaries of our staff is paid by the federal government and 50% is paid by the county. I also want to note that benefit that the family receives is 100% federal funded benefit. Therefore, I always like to note that that's federal dollars coming into our local economy that helps with jobs and helps with the production of goods and services. I also like to mention, according to feedingamerica.org, and there's some other references over the years, that for every $1 in SNAP benefits helps generate $1.50 in the local economy. So there's many sides to this program. Now the case management system. You may have heard the term NC-FAST or about NC-FAST. It was implemented in 2012. NC-FAST stands for North Carolina Families Accessing Services Through Technology. The NC-FAST system is a statewide case management system that all eligibility staff must utilize. It was again implemented in 2012. Food Nutrition Services was the first program implemented with the system. Medicaid and other programs came after. Our employees must learn program policy and procedures and how to use this statewide system. I want to note that the statewide system is not available 24 hours a day, but we must use it, okay? I also want to note, based on my past experience, statewide case management systems, NC-FAST is no different, are large, sophisticated systems that require many, many pieces of data on every customer and every household. I know firsthand, having been a policy and training consultant and role and trainer in a couple of states for a couple of systems, North Carolina and in Michigan. The design of our statewide systems is based on state and federal policy. So when the state or federal policy changes, the employees not only are learning the new policy and procedures, but they also must learn the change that took place in the system as a result. Data is entered by eligibility staff, verified by eligibility staff, and learning is very different from when I was a food and nutrition or food stamp worker in 1989. When I was an eligibility worker, there were very little system clicking going on. Training was low, not high in systems. And my day-to-day did not require a lot of technical aptitude and system involvement. Not anymore. And that's across the board in any programs and any jobs. NC-FAST, a class, is even offered throughout North Carolina at community colleges, which also tells you the magnitude of needing to learn this system. And we give credit to applicants who have taken that class during our hiring process because they're one step ahead and we need one step ahead, okay? So this is a part of the challenges of today that did not exist, not just in 1989 when I was a worker, but really pre-2012. So we have plenty of staff who have worked when we didn't have a case management system and made that transition. I'm now going to turn this over to Mariah Long, who is our food nutrition program manager, to come and talk about policy, more details. She may get a little more technical than I have, which is wonderful, okay? And then after her will be Sandra Durham, who is our interim deputy director, who will talk about service delivery and strategies.
Thank you, Adonica. Good afternoon. I'll try not to be as technical. It might be to a fault sometimes how technical I am. One thing I do want to get out the way that, you know, we work for the government. There's a lot of acronyms. We love our acronyms. So Food and Nutrition Services, we say FNS a lot. I would try my best to stick to the formal Food and Nutrition Services program, but sometimes I will slip and say FNS. So just wanted to put that out front. Let's discuss basic eligibility requirements for the FNS program. Already starting Food and Nutrition Services program. The households must be evaluated for basic eligibility. You must be a US citizen or show proof of an eligible immigration status. If an individual is not a US citizen, we will determine if their immigration status meets eligibility. For example, refugees, asylees, Cuban Haitians entrants, and most lawful permanent residents, LPRs, have a 5-year waiting period before becoming eligible. Even if the parent is not eligible for FNS due to their immigration status, their lawful permanent residents, LPR children that are under the age of 18 are eligible. Another area of eligibility is that you must live in North Carolina and show proof of residency. The customer must have a Social Security number or provide proof of an application for a Social Security number, like newborns. So you know newborns, when they're born, they don't have a Social Security number, but we need the parent to provide proof that they have applied for a Social Security number. Eligibility is based in part on income and deductions, like shelter expenses, childcare expenses, and medical expenses for aged and disabled persons. Resources are also evaluated. Once we go through the basic eligibility requirements, let's talk a little bit about processing standards, and then I'll get a little more deep what other eligibility requirements will impact a household. The processing standards for people applying for benefits. Households applying and are eligible for FNS benefits are evaluated for expedited services. This expedited approval action is to assist our most vulnerable customers who are deemed by policy as in an emergency situation. This definition of an emergency situation deemed by policy is if the household total gross income is less than $150 and they have less than $100 in liquid resources, like cash on hand, savings accounts, checking accounts, money they can get their hands on. Or if the household shelter cost is more than their total income in liquid resources. If yes, then the household would be eligible to have their approval expedited, and benefits will be issued within 7 days. If the household is not eligible for expedited services, the application will be completed within 30 days. Normal applications, these are non-expedited applications, or recertifications must be processed and eligibility determined when all information and verifications is needed to determine eligibility is received in the agency. Families are certified for 6 and 12 months based on their household type. Households that are aged or disabled with stable income like Social Security benefits would receive a 12-month certification. All other households would be certified for 6 months. At the end of the certification period, we must evaluate families to see if they're eligible for another certification period and at what benefit allotment. This contributes to the increase of the workload that Donica spoke about. Also, we have multiple touch calls that would be required to get information from customers that are recertifying and doing applications. Not all the information is provided upfront. So we might need to call the customer to interview them. They didn't provide a Social Security number for that baby that's now have time to get the Social Security number. They forgot to mention the job that they were working at. So there's a lot of touches that need to happen once we need to apply and recertify for benefits. I want to show you an application that a customer must complete. So that's part of a lot of the handouts, a lot of homework you got received today. You have one that was given to you. As you review the paper application, you see there's 10 pages back to front, full pages of directions, questions, and policy information. Approximately 48 main questions are asked. And if yes is answered, the questions can quickly roll up towards 98 questions that the customer is completing. There's a lot of words on the page, narrow margins. You see if that's a lot. As you can imagine, this can be intimidating for many of our customers and me. And I got 6 weeks of training. So there's a lot of words. You know, sometimes you got to take it slow when you're going through the application. The state wasn't intentional about trying to use layman words. easy, plain language on the application, but it's still a lot of information that's being asked on the application. So a lot of times we need to assist our customers for applying for benefits. They have follow-up questions. As we discuss basic eligibility, let's discuss additional areas that impact eligibility and benefit levels. There are many ins and outs and exceptions to the state and federal policies that govern the FNS program. This is not an all-inclusive list. However, some areas that we evaluate customers' eligibility for benefits are based on their student status, higher education, are you in college? How much income is being received by the household? Certain members are required to work, and therefore we have to evaluate each member. For example, if the household members are able-bodied without dependents, or whether someone voluntarily quit a job. We are evaluating household members for age because if someone is 60 years or older or disabled, this will allow additional medical expenses, deductions for their case, and hopefully give them a higher allotment. Additional shelter and childcare expenses will be evaluated to determine benefit levels. Again, these are not all-inclusive areas that will impact someone's eligibility or benefit level. Therefore, all questions on the application that you just looked over and reviewed or recertification should be answered fully and truthfully. If there are any questions, the trained eligibility worker will know how to address. Benefit amounts. On October 1st, 2023, maximum gross income limits and benefit allotments were increased. Yes. Each year, these amounts are evaluated for a cost of living increase. For household of one, the gross income limit is $2,430. The maximum benefit that this household can receive is $291. For a household of four, just want to bring your eye down there, the gross income limit is $5,000 with a maximum allotment of $973. The amount of benefits each household receives is based on several eligibility factors, such as the number of people in the household, total income, and allowable deductions. Because many factors go into determining the benefit amount, most households do not receive the maximum. Do not receive the maximum. For example, we currently have a family of four with mom working and earning $1,252 a month. This is gross income. She receives child support of $850 monthly and Social Security benefits $831 for one of the children. She is paying rent of $800 and utilities. Her three children are in middle and high school. This family receives a monthly allotment of $330 a month, even though the max allotment is $973. Many families that are receiving food and nutrition services are working families that receive this supplement for their food expense. The program, like Adonica mentioned, is not intended to provide all 3 meals to the families for the whole month. It is intended to supplement the household's contribution to purchasing food. I have also provided you with a printout of the full income and deduction chart to show the many if, then, and therefore scenarios when the households are evaluated. Just to give you an idea. Customers use various methods to apply or recertify for benefits. They can apply in person at one of our 3 physical locations. Great, we just had a new location open up, over the phone or online through ePass or our all access site that is locally in Mecklenburg County. The great thing about the all access site is that they can upload documents, verifications for any pending cases that they have for FNS benefits. If they want to apply for any benefit, they'll apply there and it takes them directly to the state site to apply for the benefit. All these access points are very beneficial for our customers, allowing the flexibility and multiple pathways to access benefits where they're most comfortable and are most convenient for them. These multiple ways to access and apply for benefits has also led to a high workload volume. Let's take a look at the significant increase of case and participant growth over the last few years. In FY20, so think back to FY20 is that July 2019 through June of 2020, the pandemic started in March of 2020. In FY20, we had almost 53,000 active cases and over 119,000 active participants within those active cases. As we moved through the public health emergency, we increased to over 75,000 active cases and almost 160,000 active participants. It's 53,000 to 75,000 active cases. During the pandemic, the Food and Nutrition Services Program was afforded 9 waivers to assist getting customers the much needed benefit without putting further hardship on their families. Some of these waivers provided through the COVID-19 federal public health emergency removed time limits from those able-bodied adults without dependents. We waived work requirements for impacted students of higher education. It afforded ongoing benefits without interruption. That's huge. The state was able to give auto extensions so customers did not have to have interruption of the benefits that they were receiving through the pandemic. They waived all application interview requirements. If the customer provided everything we needed on the application, we did not have to interview them to process their case. They allowed residents to use telephonic signatures to apply and recertify for benefits. Don't make people go in. I don't feel comfortable with the online system, call us and we'll take your application or recertify you over the phone. And they allowed us to do that telephonic signature. And the monthly benefit allotment was increased. The family will get their standard allotment based on all the income, how many people are in the household, deductions. They'll get that regular benefit amount. Then the second half of the month, the state will give a supplement to bring that whole household to the max allotment for the total household members, eligible members for that house. That's excellent. All great waivers for the families in Mecklenburg County and North Carolina. However, these waivers were ending and with the close of the public health emergency. With the anticipation of the public health emergency ending and returning to full evaluation of full program requirements and approximately 40% increase in the workload volume, and without state extending the ongoing benefits, we requested additional positions in the FNS program and requested additional assistance from the state. With the end of the public health emergency, the state partially continued 2 waivers. One waiver that was continued was to assist the households with the ability to continue to apply and recertify for the FNS program through telephonic signatures. Great. The second continued waiver was to assist the counties with the anticipated backlog in the program since they were no longer auto-extending ongoing benefits and the sheer volume of cases that will require full program manual evaluation was high. The waiver allowed the program interview requirement to not go all the cases, but just half the cases. So where during the pandemic, they were waived for all of them, at the end, we had to do interviews for half the caseloads. That was a requirement. We will continue to work with the state to request any new waivers to streamline and improve service delivery. Some of these requests include permanent policy changes for which collaboration with our county office and our liaison, Starla Tanner, will be needed. Also, technology enhancements are needed. For example, improving the state system to automatically approve and deny cases with stable income, that they can easily verify that income. System enhancements to cut down on the processing time of workers that must manually key in the system. Adonica told you there's a lot of clicking going on in NC Fast so we can approve or deny a case. permanently waive the interview for all cases. We use multiple online systems to verify household statements. Therefore, removing this requirement when statements are verified would further speed up our processing. Continue to extend all FNS recertifications for 1 year, so the counties can fully realize the benefits of the newly approved staff to the program. Newly hired staff are trained, mentored, and need to get to proficiency, which takes time, approximately 4 months to train and mentor a new employee and 9 months to get them up to proficiency. This auto extension for 1 year will increase our staffing capacity to meet the increased demand for the program. Now I'll hand off to Sandra Durham, who will discuss the current workload, demand, and our strategies for processing improvements.
Thank you.
Thank you, Mariah. I'd like to draw your attention to the green line on the graph, and specifically the numbers running along it. These numbers show a rise for need in our community. From county fiscal year 2020 to county fiscal year 2023, food and nutrition services processing trends show a highlighted pattern of rising need for food security in our community for over 66,000 families within this graph time span. The impact of need was 62% higher than our division was used to managing before the COVID-19 pandemic. So the state waivers Mariah mentioned were critical during this time, as they not only removed work from this requirement, but they also shortened the time to process work for all of these families representing with need of food insecurity. So unfortunately, the end of the public health emergency supports did not have a direct correlation to increase food security within our community. So thus it caused a need for us to process more in a condition where it was taking us longer to deliver those benefits to those families that were in need. So what were we gonna do? We had to come together and start defining some strategies to do the best that we could to serve these families within this environment. So now our aim and our strategies, one of them is for our applications process and finding a way to identify the fastest and shortest method of serving these families in our application backlog. So some of the ways that we gained added capacity was by hiring county temporary employees. And these county temporary employees allow us to gain strides in processing benefits. Another hiring strategy we used was to hire contracted temporary staff. And these temporary staff came into place to offer supports, but the greatest impact was in our call center environment, where we were able to remove 67 eligibility staff from the mandated requirement to staff our phones and align them to a concentrated focus on processing. Lastly, we offered overtime, and overtime was offered during our standard business hours, during our holidays, and during our weekends. But there's always a barrier, because even though we offer overtime, the state system is not available 24/7, and it's often unavailable on weekends as well, according to the schedule that the state provides us. So as this processing graph depicts here, as we deploy these strategies, by the rising bar and upward green trend line from the close of August 2023 to just recently October 8th of 2023, these strategies for improvement are working, as evidenced by the consistent gains in bi-weekly processing of our food and nutrition services applications. My peer in Wake County, another leader of the food and nutrition services program, one of the counties that directly represents similar in our status, reached out and said, what are you doing? Help us to leverage your strategies and your processing gains. And while we are always open to collaborating with our colleagues, unfortunately, we are finding that in Mecklenburg County, we're the trend center. We are the one that they are leveraging our strategies instead of us being on the receiving end of ways to find a way within this state system to serve our customers faster. A secondary line of our workload on our improvement path is our recertifications, where, as you can see, they're increasing in volume month over month as we removed the public health emergency supports. Along with the added capacity strategies that I mentioned earlier, this focus really looked at the creation of specialized teams. And these specialized teams that we formed are our most experienced and fastest staff with navigating the complexities of our NCFAS system. As an additional improvement to processing, we wanted to look at the multiple visits that customers had to make in our overdue backlog work. We also wanted to look at the multiple documents that they were putting into our work stream that increased the amount of work that we had to evaluate. So we achieved a way to reduce this impact by developing an escalation process for customers within our overdue backlog. So now in this process, at the first encounter, when we recognize a family is overdue, we first offer an on-site food pantry referral. Secondly, we offer a Loaves and Fishes food bank referral. And in a recent discussion with our partners at Loaves and Fishes, we found out that the participants that they are serving that are receiving food and nutrition services equate to 25% of our customers. So of the whole, even in this backlog crisis, our partners are serving 25% of our customers that are food and nutrition services recipients. So when this family is coming to us in this crisis, we are aligning this specialized team to them. This specialized team has a guaranteed service delivery to answer this family's need within 24 to 48 business hours and call that family and let them know that the processing has been completed. Now, with any escalation process, there's still a requirement. So there are multiple documents that still need to be verified. We're operating within a policy-rich environment. So if the household has not provided those documents we need to continue processing the case, then our escalation process has to wait until they provide them for us. Lastly, as our strategy, we had the introduction of supervisors now, even coming into our case processing flows, where they are managing a smaller cycle of processing time, but still critical because it is giving a needed answer to the families that are awaiting. So I want to draw your attention to this graph here. Once again, this is our food and nutrition services recertification backlog. And this graph is showing a month over month comparison of our backlog. And I want you to see that we were slow or challenged in delivering an answer month over month to over 5,000 families. But through these strategies in October, we were in the hundreds. And praise God, I'm able to say today that we have 16 families that are now on this backlog. So the strategies are working, even in this challenging system, even as we wait for staff to go through their training, we are doing the best that we can with what we are blessed to be able to receive. So I just want to thank you for your time and your consideration of the great wins that we're able to achieve with the staff that you've blessed us with. With that, I want to turn the remainder of our presentation over to my director, Donica Hampton.
Thank you, Sandra.
You're welcome.
And just one clarification for something that Sandra said. When we met with Loaves and Fishes, it was 25% of their customer base is FNS. Not 25% of our customers are there. 25% of their customer base are FNS recipients. Talking about strategies. Talking about strategies. Thank you, thank you, thank you. County commissioners, county manager, for the additional 186 positions to our division. Thank you. These positions are helping us manage the high workload demands across all of our programs and prepare us to serve the new customers with Medicaid expansion. Thank you, thank you, thank you. This slide is specific to food nutrition services. It highlights our skilled staff in the program, delivering services in this program, as well as our progress toward hiring and training. The 162 at the first bar represents our skilled, either partially or fully, staff trained to deliver services in food nutrition services. And you'll see bar for 41 are those staff for food nutrition services only that are in training now or mentoring. And the 10 are staff being hired this month. As long as we retain our new staff, most of them, that's a challenge all across every area of our society. As long as we retain our new staff, we expect most of them to be able to deliver services, even if it's not at full capacity by April 2024, because it takes about 4 months of training and mentoring to get to that point of delivering of services. Smiling faces. These pictures are taken at one of our or multiple Saturday hiring blitzes. So I call them our hiring blitzes or hiring events. And we thank our ESD staff and staff across many departments, many divisions. We've had over 60 employees, whether it's from the health department, thank you, from Child, Family, Adult Services Department, thank you, Community Support Services, thank you. Join us on these Saturdays all day where we interviewed candidates and we made hiring decisions on the spot. I've never been a part of such an event. It was successful. I'm grateful for Mecklenburg County HR team, our partners at Novant, who also helped make these hiring events successful. Our goal was to hire 164 eligibility staff by October, and we hired 158 by October, which is pretty awesome. We could not have done it without partnership across our Health and Human Services teams, and we really, really thank you. 31 of these new hires are specifically devoted to food nutrition services. Now, the number 31, remember, we had 75 specifically devoted to Medicaid expansion. So when we looked at our workload across all of our eligibility program, we needed to do a proportional share for FNS. So FNS cases amongst all of our eligibility is about 1/5. So therefore 1/5 of those additional positions were devoted to this program. As we conclude our presentation today, I want to say that we have much work to do. Our staff are working hard and we appreciate them. We are heavily relying upon the new staff to become proficient as soon as they are able to. Today, we provided an overview of our division, overview of programs and services, structure, staffing, an overview of the food nutritional program, the challenges that we face that are still challenges that we're still facing, of increased workload, our strategies for improvement, utilizing temporary staff as we can. We can't utilize temporary staff in all the ways we want to based on rules and regulations. Working overtime, supervisors processing cases, specialized teams, overdue case escalation that Sandra talked about. We are in conversations with other large counties about best practices so that we can help each other. We're not in the boat by ourselves. Today, we also provided updates about staffing and hiring. It takes time to see the results of these new staff that are in our program. It's the magnitude of the regulations, the policy, again, the technical skills that are needed now. I will be working with our department director, deputy county manager, county legislative liaison, and the state to make those necessary improvements to our service delivery, to make recommendations on streamlining systems, policies, so that we can serve our residents to the best of our ability and successfully and effectively and efficiently. We do need policy and technology changes. We need administrative flexibilities to serve our residents. We work with workforce development partners, community partners, but the picture is just so much bigger than one agency. And Commissioner Griffin talked about the intent of these programs, as well as we're talking about huge systems. We're talking about bureaucracy. I've worked in training and development in multiple states for systems and policy, and it's just not simple. It's complex. It takes many factors, many agencies at all levels of government to make this work. I am committed, our team is committed, we're all committed in this room to do what's necessary to make the recommendations, to sit at the table, to serve our residents to the best of our ability, which means providing services that they need and they rely upon us to provide. This concludes our presentation, and I'll ask Mariah and Sandra to join me at the podium as we are available for questions that you might have.
Well, thank you, Ms. Hampton and Ms. Durham and Ms. Long. Thank you so much for a robust presentation on income maintenance, but more specifically on the SNAP program or food nutrition services. Colleagues, let's start off with a 3-minute round of questions, and I'll start to my right with Commissioner Meyer, Commissioner Powell, Commissioner Leek, and I'll offer our guest a 3-minute round if she has any questions too, okay? So I don't have anybody have okay, I'll have my phone. Do I keep up with the time? Okay, 3 minutes, let me know. So I'll have to pull the hatchet out on my folks. So, all right, Commissioner Meyer.
Okay, wow, that was a lot of information. A while back, we got notified by the press that there's a backlog, and we're all like, you know, what's going on? And all we got was it's complicated, it's complicated. So thank you, it is complicated. And I think that it does clear up a lot, but it still doesn't make me happy. I wanted to first say that thank you to our staff. You guys are amazing. You're down and dirty. You're, you know, facing the people. You're hearing all the terrible stories, and you still come to work every day. And it's amazing to me that you do. So thank you. And I just want to say that we support you. And first of all, are those employees, are they temporary or are they permanent?
The new employees, that we are, so let's go to a slide. Those 31 assigned specifically are from the new positions that we received, and they're full-time employees, not temporary.
Not temporary.
Yes,
okay.
All 158 are permanent because
all of them.
Your decisions to approve the budget.
Okay. Okay. I just want to make sure. I think I heard temporary, so that's wonderful. So in a nutshell, what we're looking at is the federal government's given us money. The state takes it with a lot of rules, and they tell us what to do. And the problem, and I call them roadblocks, those were taken away during COVID. And so things are streamlined, things are great. I mean, COVID kind of phased out, and now we're back to where we were before, but with a whole lot more customers. And at the very end, I love everything you said at the very end. I feel like you guys were very careful and very kind in your presentations. But I'm not going to be careful and kind because, I mean, we've got a real problem, and I see it at the state level. And I don't care about making the state mad. We've got people we have got to feed and we have got to house. Are they listening to you? You said you were going to continue to work with the state, but are they listening to you?
The state is listening to us. However, it's about delivering and making change. Mm-hmm. So yes, listening. Yes, understand. But action is what is going to make us all happy. So I would join you in saying we're not happy either. We want to serve the customers. But I say yes to listening, but action again. And the rules are both federal and state rules. Okay. So even these waivers, correct me if I'm wrong, had to be approved by the federal government. So what we want to make sure we're always doing at the local level is standing with the state and the county as Mecklenburg. We have, stand with the state and pushing those waivers and pushing permanency, because even the telephonic is still a waiver. It's still a temporary change. We need to drive permanent change in these programs, and that's what's going to take us all.
I just want to say, do I have time? Last night, I don't. I'm done.
Okay.
Come back to me.
We're coming back to you. We're coming back.
Thank you.
Commissioner Powell. Just write it down. Hold your power. Commissioner Powell.
So, when you said they're listening and understanding, what kind of, and maybe you're part of this, Mr. Troutman, what kind of action have you requested? I'd like to know what kind of action you requested.
So we've asked that they are, let me pull out my notes here.
And while you're, because he's timing,
Yeah, no.
but while you're looking in your notes, also I'd like to know, like, from whoever wants to share, in your experience, and the people that you're working with, and the experience that, what you're hearing, what is the cause of the extreme growth in the workload in Mecklenburg County? Is it unique, or is it shared universally, or is it North Carolina? What is your experience?
It's not unique, and it's nationwide. And when we're talking about a time frame from pre-pandemic to now, what I'll say is our society has changed. Individuals in jobs, the jobs are still unstable. Job wages are still low, and there is, I think, an additional volatility now. Okay. It's nationwide. It's not unique to Mecklenburg.
I think potentially some of these individuals are eligible before the pandemic, but they heard about these benefits and they began to receive the benefits. And many of these jobs, these part-time temp jobs, Walmart jobs, that's who we're talking about as far as the working poor that's receiving the benefits.
That helps. Yeah. And on the amount of, you were going over the amounts that they're eligible for and the amounts they receive. Is that per week, per month? What is that?
The amounts are monthly.
So they're monthly.
Yes, monthly allotments.
And so back to what action?
So to permanently waive all the interviews for all cases, that's been requested to continue. To permanently waive the interview for all cases. To permanently allow the telephonic signature. And we want policy to change to accept attestation of income. Since we have so many systems that we can verify it, let's accept the attestation of the income.
So before you go, so waiving of the interview means that we take the application and make a decision on the application. We have to take the application and then sit down with the person and then go through this 30, 40-minute interview, and it just adds extra time. So when she says waive the interviews, that's what she's talking about.
I think the other piece that was important that they emphasized was the telephonic signature. And as Donica said, that is a waiver. With the telephonic signature, if we had done that interview over the telephone, we would still have to send something to the customer to get them to sign it, right? So the waiver allows us to be able to accept that application based off of talking to them on the phone rather than having to have a physical signature as well. So all of those things, when we talk about the waiver in the interview, when we talk about the waiver for the signature, those help speed up our ability to process the cases where we're not having to pend for information, wait for that information to come back in, follow up if we don't get the full information. So it allows us to streamline a lot of those different touches. As they talked about, when individuals apply, you have up close to 100 questions depending on what the person's situation is. Then we have to do the recertification. So we're reviewing their eligibility again. But in between, if they have changes, every time we have to pin for something, pin for a signature, pin for you to complete an interview with us, that adds time to our processing and our ability to get that work done. The other piece that is really critical is that system, the NCFAS system, and we're not in control of that system, right? All counties use that technology. It's a lot more complicated. I used to do food stamps years ago as well. And we can all attest that have done food stamps, the time that it took us prior to that additional technology being in place compared to the time that it would take now to do a case is a tremendous change. A lot of additional time, a lot of having to click different information, verify information in the system. Where, as Mariah mentioned, there are some instances where if you know that a family's income is stable, their situation is stable, we should not have to go in and do all of this acts and tasks within the system. And that would be able to increase our ability to focus on those cases that may be a little more complicated.
More flexible income.
All right.
Yes.
Receiving direct payments.
Yeah, let me move to Commissioner Leak so we can have another round. Commissioner Leak.
Thank you. First, let me say thank you for your presentation. And as I listened to the presentation, I thought about my district, District 2, which is the hub of basically of what you're working with, my people. And that's why I raised so much sand about passing a budget. It's important to have a budget and to pass a budget to serve the people that we're trying to serve. And one of the things we have to look at is growth. That the number of people coming into Mecklenburg County who are poverty stricken in the first place, not just citizens, but non-citizens coming to Mecklenburg County because they hear that it's a good place to come. And if we follow the government, they're sending people across this country to different states for the states to take care of poverty. And when we talk about education, we are saying to the school board and to everybody that you must educate our people so they can become prepared not to be recipients of self-help. So it grieves me to sit here, but yet I feel good because of your presentation and what you know and how you're doing it. We are a big operation. We are not a kitchen backdoor business. That's right. And some people have taken it from that perspective, not ever sitting on a corporate board at all. I never sat on a corporate board making decisions that impact the lives of people that I may not ever see or may never know. But to know that we have competent people who are trained to do the job, regardless of your race, color, or whatever, you're competent. But the one thing that bothers me, that all of these programs are centered around women and not helping Black men to become prepared to be able to take care of their families, and that's education. All of them. I heard you say the women. So we've got to do a better job of saying to our community and to our children that men need to be trained also to understand the responsibility and not come into the household to sit down and babysit while the women go to work. That's what I see all across my district. That's what I see across my district. So what can we do to make it better? Pass the budget and live by the budget. Thank you.
All right, thank you, Commissioner Lee. Commissioner Susan Rodriguez McDowell, please. 3 minutes.
All right, thank you, Mr. Chairman. Thank you all for your work. You guys are amazing. I do have a few questions and I'll try to go a little bit fast so that I can get them in my 3 minutes. On page 12, I wanted to ask about on certification. Can you speak to the disabled? Are they 6 month or 12 month?
12 months. So if the whole household is age disabled and they have that Social Security income, SSI, it would be for 12 months.
Okay. Okay.
If you have an age disabled person, you have children in the household, and they're not disabled, then it'll be a 6 month certification period. If you have if it's all disabled, then it would be 12 months. We also have a program that it is if they have 65 or older and receive just SSI. I don't want to get too technical. They'll get a 3-year certification. But that's under the SNAP program within FNS.
Uh-oh.
Yeah, I don't want. I watched it.
Okay.
Yeah, there's a North Carolina program called
Yes.
SNAP.
Simplify, yes.
Okay. All right. Super complex. I got the
Yes.
message there. And does disabled, is there any differentiation between physically disabled or developmental disabilities or?
However, the Social Security deem you disabled, doesn't matter. We're not the medical professionals, whatever Social Security deems you as disabled.
Okay. And one of the things that somebody said, they use the word truthful, or else this, I just wrote this down. What if the people are not truthful? Does that disqualify them in the future, or what happens to you if you're not truthful?
So if you're found to intentionally try to violate the program, you will be disqualified from the program. And there's different stages of that. So you might have a first disqualification period for a year. And if you're found to do intentional program violation again, then it gets extended to 10 years and then permanently if it continues.
Oh gosh, okay, all right. On page 19, when you were talking about overtime and, you know, first of all, is overtime paid, do the feds pay overtime too, to the same degree that we do? Or do they say, you know, we don't pay overtime, so county has to take care of overtime?
So the cost share is the same. So employee salaries for this program, 50% county, 50% federal.
Okay, so if we have a huge overtime budget, the Fed doesn't go, you got it. Okay, so they pay for it. And why is the system not available 24/7? Can you help us understand what's the deal with that?
Yeah, so what happens is you serve the families each day, the system has to record that transaction and then deliver the benefit. So if the system was operating live, if we make a mistake, we don't have the capability to quickly pull that mistake back. So it waits until processing is completed at the end of the day. It registers all those transactions. And on that next day, it delivers those benefits and it publishes the reports for us to see.
So you're saying that it's not a bad thing, that it's not available 24/7?
It can be a bad thing because in this dire situation, or even as our director spoke about disaster situations, you want to be able to put all hands on deck at the time that our staff are ready to deliver.
So that might be something we should advocate for. Sorry to interrupt. I'm just trying to go really fast.
Yes, and an increased availability to the system, right? We do understand that it has to go down for a portion of the time, but increased availability would be great. And we used to have increased availability, but they noticed that sometimes technically they could not get the system back up on time. So they gave themselves some of those hours back.
Okay. Right, let me.
Is that the end of my?
Let me go to Commissioner Meyer for your 3 minutes.
Thank you. And I'll go fast as well. What can we do as commissioners? How do we support you when you're going to the state to ask for more streamlining, et cetera? What can we do?
So I definitely will be working through my department director, our deputy county manager, because that needs to be strategic. So we're not at the place of coming to say what you can do at this point. What we want to do is deliver on what you've already done, which is those positions. That's where I'm focused. So we may be back at some other time. I'll yield to deputy county manager.
I'm ready to rock and roll.
But it needs to be strategic.
I understand.
It really does, and thought through.
Okay, and the signature, what did you call it? Phototronic? Telephonic. Is that a, that's just like a DocuSign, right? Isn't that a DocuSign?
And you know, it could be like a DocuSign, but we just use their voice. We don't even
Okay.
record their voice. We even waive that. We just say, do you give us permission to sign this document? They say yes, and we document that they gave permission.
But you can't do it now.
Which is a yes, we can,
You
but
can.
it's still a waiver.
Yes, it's still
We
a waiver.
want that to be
You want that to
permanent,
permanent.
Permanent.
And
Okay.
that process was because more technology would be needed if we were to do.
Okay.
So I'm appreciative that that was able to be streamlined so we can just over the phone.
Okay, and then just one last thing. Last night I was at a poverty lecture, and we heard that we give more benefits to the top 20% of wage earners. I mean, we're talking the top 20%, way more than our bottom 20%. We're making them jump through hoops, and those top 20% are not, and the system is broken. But the thing that we heard over and over is we can change this, and it can be changed. There was hope. Thank you.
You still got a minute.
Wow.
Okay, all righty, Commissioner Powell.
Thank you. On slide 14, I'd like to ask you to first thank you for your work. And I love the way you answered the question, Adonica. It was so genuine, you know, about being strategic. And I really appreciate what you said. But I'd like you to expand on slide 14. You were talking about how if you can't immediately help someone for whatever reason, that you refer them to pantries. And, you know, someone corrected that 25% of the families you're referring are going to Loaves and Fishes. What other pantries are you referring them to? And just expand on this. Tell us more.
So first, it's the food, Loaves and Fishes. We had a recent meeting with them, dialogue with them, and they told us 25% of their customer base receive FNS benefits. That's one. Okay. And we'll talk about the delivery.
Right. And so customers can self-refer themselves to pantries. And so we always have an updated list of pantries within the community. And they often select the pantry that's closest to them because it could be an issue with transportation or even transporting the goods that they're able to receive. So we maintain a list, but of course, Loaves and Fishes is the one that has given us a quick referral process. So that's easier for us to assist the household, where all the others on the listing require the household to complete a self-referral.
We have pantries within our 3 access points as well.
Office locations. And do you feel like Loaves and Fishes has received the bulk of it because of the quick referral process? The bulk of?
So that's a challenge, right? Because we're not referring these households. And so we don't really have that capability to capture what portion of the households are going to other food banks that are also our direct customers. Right. So there's a data challenge there that I don't feel comfortable saying that I can rightly say where they're all going within the community.
So that really helps, like my understanding of what, you know, some of the things I'm hearing.
Thank you.
I appreciate that. Thank you.
Yeah. Okay, rocking and rolling. Commissioner Leak.
Again, let me say to us, nonprofits find a way to become very profitable. And you have to ask for the budget that they have, because somebody is making money off the backs of poor people. Am I right? You're saying yes?
Yes, ma'am.
Thank you. I watch Judge Judy a lot. And a lot of people are always before her about assistance. Either if they're enrolled in school, they get their check, spend it any kind of way they want to, and not utilize those funds as they ought to. Then people who come to America find a new way to get to Billingsley Road, Bateswood Road, and get in the system. That's all they want to do is get in the system. So how do we adjust our community to correcting those problems that we have of hanger-oners? But I still say our programs are geared for women. We want to make sure that we stop this business of our community dependent upon our women and build our men and young boys as we ought to. And the federal government is a prime example of what I'm talking about. Am I right? Nobody's saying anything. Out in the street, they know what I'm talking about.
What I will say is that this program was specified benefit for food only. And it's been very good at providing the intended need that is designed for as far as food.
Let me say this quickly. Just some months ago, everywhere you look, there were trucks of food coming to the community where we live and in my district. Every week, every Monday, Wednesday, and Friday, or Saturday, there were truckloads of food being brought into the community. Fresh fruit, eggs, chicken, ribs, all kinds of items coming into the community. And that was a help to people who did not have the funds to actually to pay for the food. So how do we continue to receive those items through your system? Are you aware of it?
Yes, one great thing that we recently learned about is exactly what you're talking about. There are farmers markets, and they have within this program the Double Bucks program.
All right.
And so if you go to the farmers market, or if you go to Food Lion, for example, what would be $50 at Food Lion is $100 if you go to the farmers market. So they are really leveraging the availability to give fresh fruit and produce to these families that are receiving these benefits.
And what we have done is tracked them in my district. There are a group of us, a group of people who serve this community, not just me as their representative, because I represent the people, but they do the work and trace where those trucks are going to be. So our people will get word by phone, a word of mouth through church, and we are trying to stay on top of it.
All right, Commissioner Lee, going to move on to Commissioner Rodriguez McDowell.
Thank you.
Thank you.
Thank you, Mr. Chairman.
Certainly welcome.
So can I just ask you to, on the last page, on page 20, you know, the number goes like way down and the last number is 637. And then I think in your final comments, you said there were 16 families left. I was confused by that.
Yeah, so at the time that I had to deliver the slide deck, this graph is looking at the start of the month because the recertification is due at the end of a month. So these were the numbers that carried over as being late into the beginning of the month. So you see on this line that date is actually October 2nd. So to give you an update on the processing that has occurred up to today, those families that were 657 or 37 are now 16. So processing continues to occur day after day for these families that were in our backlog.
So today is the 17th. So you're saying on the 17th, there's only 16. That number goes down to 16.
Yes, as of this morning, it was 16.
Okay.
And so we were able to evaluate those, Mariah's staff, and those are in the pending process, right? Where we said we're waiting for the households to deliver the documentation we need to finish that recertification.
So then does it go back up in November? Because it rolls, you know, like a, or does it stay down?
Well, fortunately, we're processing timely along this work path now. So depending on when customers respond to us or when our first touch is, we are still having a few roll over, but not in the thousands as we were having before.
Okay, so these are the recertifications. And what about the new applications? How do we, are we doing those on a timely basis?
No, we're not doing those on a timely basis for all of the applications, but our expedited applications, which are our most vulnerable citizens that we have to serve within 4 to 7 days, we are now operating timely for those, and the state requirement is 95% process on time. And where are we, Mariah?
97%.
97%.
Okay. So that's the expedited. So then there's one more category.
Yeah, the
and
normal
that's
category. So as you see our capability, because what we're doing is we're shifting staff
to
workflows, right?
Right.
So we stabilized our expedites. We've stabilizing as the evidence here our recertifications, and now we're shifting more of those staff to the backlog of applications.
Okay,
So
see,
you'll be
can I
able to
just,
see marked
yeah,
improvements.
here's a little problem, right?
Okay.
And the problem is that if we don't ask the right question, we don't get the information. So like, just, I mean, that kind of takes me off a little bit. I really want to understand how if we don't ask the right question, we don't get, it looks like everything's like, you know, rainbows and unicorns, you know? And that I just had to put a pin in that. Good. Looks like my time is up. It's a good thing.
You certainly put a pin in that one. We don't have enough time to do a 3-minute round again, but the chair will be gracious if anybody got any pending one quick question, because I haven't said anything yet. I'll summarize my 2-3 minutes in about 30 seconds or maybe 60 seconds. Okay, Susan?
Just one last question I had was about retaining the new staff. Do you guys have ideas on how to do that? And do you feel confident we're going to be able to?
So we are, first off, really engaging new staff. You know, what I've said to our leadership team is those of us who've been in the business and been doing this for a while, we can't look at our new staff like we are or we were 30 years ago. So we need to engage with them, and we are. We have forums, they're invited to the forums, we're listening to them because that matters. We need to have an agency that is conducive to our new employees coming into the agency. So we've got to be willing to change. Okay. So those are some fundamentals that we are talking about as leaders. We're looking for space. So we got a lot of new hires, but the building is still the same size. So we're making changes there so that they can be as comfortable in their learning process. So those are a couple of things that we're doing. Am I confident? Sure, I'm confident. Because we must, and we know what's at stake. And so our staff every day are coming in to work to really deliver services to the best of our ability. So we're going to do it. I can't predict how many. This is and I want to say this is not a simple job. So some staff may not stay because, and I've seen it over the course of many years, it's not what they thought it was.
Not to cut you off, I got Commissioner Powell.
What is the time requirement from on normal processing, normal application? What is that requirement?
30 days to process.
And so I would like to request a slide that says where we are, slide just like this, on where we are on normal application process, because we need to know. So thank you.
Okay. I'll wrap it up with my comments, and certainly want to thank my colleagues. Poverty is hell. There's not a community in the continental US of A that I'm aware of that makes poverty comfortable. All of these are comfortable.
Right.
The application processes are just crazy. We'll find ourselves being in the same position as school board members that are hiring bus drivers, that are hiring cafeteria workers in terms of turnover. If the county manager wants to make a recommendation to pay these people $100,000 a year, we'll probably have a lower turnover ratio. The system is the system. And you can squeeze it on one end, it's going to come out on the other end as relates to poverty. And poverty in America, unless you're in Appalachia, but in the southern states, it looks black or brown, et cetera. And so we're in a position that we can challenge the county manager to up everybody's salary and get a different piece if you want turnover changes. But it is a crazy system. But what I want to say to y'all is this zaps your humanity. So if you guys, it zaps your humanity. Right. It takes your dignity away. Exactly. If you got to report every dime, every raise you get every 5 minutes. That's why I always talk about upward mobility. If you're on this system for a decade or so, I don't know how you even breathe or live in terms of the will to get up and get into one of these workforce. We're killing people. Poverty is zapping the wheel. And we got to do a better job and change the culture in Mecklenburg County, at least, where it's upward mobility. I mean, I would love to have an apartment complex that's an upward mobility apartment complex. You go to that apartment complex from the beginning, it's up and out. Here are the services. You know, there's a category of people that we're always going to have to provide support for. The elderly, the disabled, physically, mentally, et cetera. But we're going to have to change this paradigm because, as I said to you earlier, the people who make these rules, I think someone said even the state has to get waivers approved by the feds. Okay? These things are specifically designed to be onerous at the federal level. And then the ripple effect comes down to the local level and people pulling their hairs out about how, you know, we used to sue the county and the state so often that President Reagan said, you no longer can do class action lawsuits, sue the federal government. But the programs are stupid. Okay? We literally sued the federal government and state government on a regular basis until Reagan said, we're going to change the rules for legal aid. Y'all can't do no more class action lawsuits for poor people. So poverty is, and I was on poverty. It may have changed. Okay? I can show you all the papers that I got from my dad that we keep up to just show y'all. It zaps who you are as a person. So I think I really appreciate the passion. The staff will follow up with whatever follow-up questions that have come up. But I hope we can figure out a way to deal with upward mobility in a different perspective because, you know, these programs are not designed with the intent that some people think they're designed to do. And I think the lady said, they're not even designed to give you enough food. So you're forced to buy stupid food. People talk about children are hungry. I turn around and say, okay, now Dr. Washington is telling me they're obese. So they're either gaining weight or they're eating the wrong foods or something's happening. So, you know, poverty is just a trip. But I appreciate you all. The chair would certainly entertain a motion to adjourn. So and I can go to my 3 o'clock meeting. And properly moved in second. All those in favor say aye.
Aye.
Opposed, same sign. The meeting's adjourned. Thank you all very much.
Thank you.
Yeah.